Hey, welcome back into Mid Morning, everyone. Dr. Keith Watson is joining me, and if you see our background right here, we are talking about autism, and Autism Awareness Month is actually this month. And I felt like it was the perfect time to, talk to this out loud because I feel like this is a big conversation, especially publicly. And so, Dr. Watson, I guess with you as a pediatrician, what is autism?
Autism is a developmental disorder.
Okay.
So a person that has autism is not sick, it's not an infection. It's a developmental disorder in which children have varying degrees of speech delay, poor social interactions.
Okay.
You know, the classic picture of the child with autism is they don't recognize faces, they don't form emotional bonds with people. And to some degree that is correct.
Yeah.
A severe form of autism, a child cannot interact socially at all.
Okay.
They're in there, for lack of a better way of saying it, their own little universe.
Yeah.
But at the same time, in lesser degrees, you can have some social interaction. So it's a combination of symptoms where a child has speech delay, social delay, developmental type disorders, cognitive impairments.
Okay.
That type of thing. It's a global kind of developmental delay.
And then also I want to speak about, like you were saying, children that may be diagnosed with autism are in their own little world, but a lot of times the children who have autism, they are so smart in particular areas. Correct.
There is a condition, and I believe the word is savant.
Okay.
You can be impaired in a simple area, but you may be a mathematics genius, so to speak.
Yes.
Yes, that does occur.
So with you as a pediatrician, obviously you said there are delays. What is kind of the age that we see autism, or we're maybe able to identify it most?
This is changing.
Okay.
When I began practicing, which was, 25 years ago, it was very difficult to diagnose prior to about 12 to 15 months of age.
Okay.
Because you would then start to notice that the child didn't speak.
Okay.
Or had impaired social interactions with his peers. Now there is evidence that you can start to detect potential issues as young as 6 months.
Wow, that is very young.
Very young.
That is so young. And then also, I think it's interesting because they can't talk. A 6-month-old that I've ever known cannot talk. So that is also interesting. But guys, stay with us after the break. We're going to be talking more on autism and autism awareness. Stay with us. We'll be right back. All right, welcome back, everyone. So we are speaking about autism because it is Autism Awareness Month. And if you were with us before we left for the break, Dr. Watson was telling us now with today's world, we can possibly identify autism in as young as a 6-month-old. So talk to me about the symptoms, I guess, that we would see in a 6-month-old.
The biggest indicator is potentially lack of an infant smiling.
Okay.
Babies learn to smile at their mom and dad around 2 months of age. An infant that has not yet developed a social smile at 6 months, that is a high risk indicator for something like autism, because autism involves lack of social interaction. And so if the child does not smile as an infant 6 to 9 months, it doesn't mean they have autism. But that is a really big red flag for us pediatricians. And
so you as a pediatrician, how does the testing go? Is it a neurological test, or you are just seeing the symptoms and then we go from there?
Pediatrician would see the symptoms.
Okay.
Concerns with speech, concerns with social interaction, inability to follow directions, becoming agitated if they're in and around people. Anytime there is a big what we call sensory input from the noises, those type of things, crowds, if children become agitated and uncontrollable, those are all symptoms of autism spectrum.
Okay.
I would then send that child to a specialist, a pediatrician who is trained to diagnose autism. They would do the testing. There's no blood test. You don't draw blood. It is an evaluation by the specialist who examines the child, watches the child, talks to the parents
Yeah.
about the concerns, directly observes the child, and then if they fall into the criteria that is set, then that child would be diagnosed as having autism spectrum.
And then from there, would we take medication, or you're just diagnosed so now we can know what to do?
You can do both.
Okay.
The treatment that is considered the standard of care in terms of medicine is something called ABA therapy. It is therapy by specialists trained in that area to provide therapy to someone with autism spectrum. Medications are more for symptoms. If your child has autism and they become highly agitated and kind of become uncontrollable and are kind of screaming and get, as we say in the South, out of sorts in situations, and they can't be calmed down, there's medication to try to help keep them calm. There's those types of medications for symptoms, but treatment is therapy.
All right, guys. Well, if you have any more questions, you can always visit Dr. Watson in West Point. We'll be right back.